Hey guys, Dr. Jere here with Mills Chiropractic and Wellness Center. And last week we talked about how wrist pain, arm pain, hand pain, those kinds of things, numbness, tingling, coming down the arm, can often be related to neck problems. And today I just kind of wanted to piggyback off that a little bit because I was reminded today as I saw a patient that sometimes we may not even have neck pain. So even though this month we've been, kind of focused more towards the neck pain side of things, there are often times when we irritate a nerve or pinch a nerve, or maybe we have what's called spinal stenosis, which is narrowing around the spinal cord or around the spinal nerves as they exit, that these things can often present with no neck pain and just cause numbness or tingling or even weakness in a hand or an arm. Spinal stenosis is one of those things we love to see in the office. It's a kind of a multifaceted issue, and there's lots of stuff going on. But I enjoy working with spinal stenosis patients, mainly because it lets me use a whole bunch of different things, because we do have to address the joint side of things. We have to address the altered movement side of things. We have to strengthen muscles. We have to stretch muscles. We have to sometimes do some things to get the nerve to release, to reduce nerve inflammation. And so, like I said, it kind of lets me dip into my tool bag a bit, which I really do enjoy, being able to put the pieces together to figure out what's going to work the best for each patient that walks through the door. We don't necessarily have like a cookie cutter approach to it, but that's one of the reasons that that patients come to see us, right? And that's why we get such good results a lot of times with these cases. When oftentimes by the time they get to those points, they're usually looking at surgery or a regimen that's leading towards a surgery. And if we can get them going in the right direction, we can oftentimes, and I would dare say almost all the time, I can't say completely, but a high percentage of the time, keep them from having to go down that pathway into surgery and into those more invasive types of things. Simply because we do kind of look at the whole thing, and we look and figure out which technique's going to work the best. And so, like I said, we're kind of picking back off of last week, but I was reminded again today when I was talking to a new patient that does have some spinal stenosis and does have some challenges with some pinching up in the neck, but there is zero neck pain going on, and it's just all arm tingling. That is the biggest complaint. And the good news is, hopefully, like just with this patient, we can get in front of it and get to taken care of before it progresses into those next stages of pain and disability and muscle weakness and things like that. And so, again, I hope you got something from today, but until next time, stay healthy and stay well.